All across Oregon, chief medical officers at the state's hospitals worry about the Omicron surge. At Salem Health, 85 patients are being treated for COVID. Dr. Ralph Yates is the chief medical officer here and says the hospital is already at 112% capacity, more than full.
When a hospital is at 85 to 90%, that's 100% because you're counting all beds, your labor and delivery, pediatric. When we say we're at 112%, those are real numbers, and that's a real problem.
For some context, most patients in Oregon's hospitals do not have COVID. They make up the blue in this chart. The orange shows the COVID patients coming in on top of those regular folks, and the gray shows how much room is left on average statewide. The gap gets smaller going to the right, which is the most recent, and by the way, the chart is a week behind. In Salem, the hospital is already getting creative about finding space.
We have a gymnasium in our rehab floor, or in our orthopedic floor, and that gym is being utilized for patient care with screens. And we will be doing more of that as we need to. We'll figure out how to get through it.
That determination and the concern is similar in Bend at the St. Charles Health System, where Dr. Doug Merrill is the chief medical officer.
We're all very anxious about what's ahead of us over the next month.
St. Charles has 51 patients with COVID, 7 in the ICU. None of those 7 is fully vaccinated.
We do believe that we're seeing some advantage for people having gotten vaccinated. We do believe that we're seeing advantage for folks having boosted.
This chart, updated through Thursday, shows the statewide numbers in Oregon for people hospitalized because of COVID. The dark top line shows the previous high point this past September. Look to the right and you can see it's on the way back up again, almost in a straight line. Down below, that middle line shows the COVID patients in the ICU because of COVID, and the pale line below that shows patients on ventilators. Both lines are now starting to go back up a bit, but not nearly at the angle of total hospitalizations for COVID. Still, people sick with COVID and other issues are already swamping the ER.
And one of the issues I think that isn't picked up on when we talk about, the severity is less. Our ERs are already overrun and are headed for basically triple their normal volume over the next month or so.
Both doctors agree you should get vaccinated and boosted and wear a mask. And by the way, do not take any risks that could land you in the hospital.
I saw it well put the other day from an ER doc on the East Coast, and that is wear your seatbelt, stay off of ladders, don't do stuff that's risky. This is not the time to do it.